concerning the last part of the presentation, as I mentioned at the very beginning, our organization undertakes different activities. There are some activities that are focused to support families, and they are centered in informing families and empowering families. Concerning support for families, we give vital services such as the CDG International newsletter that is available in 3 languages. We have as well access to scientific articles. The scientific articles, they are previously selected and then they are distributed amongst the families. We have different leaflets targeted to medical doctors or to the society, and as well leaflets focus for families, in which with a non-specialized language we explain the CDG. And we have as well the social networking, which are different websites on Facebook that allow families to interchange information. We have the CDG United or the CDG Family Networking in English. We have the Facebook webpage for the Spanish Association. We have as well the CDG Facebook webpage of the French Association. And finally, we have the same kind of social networking for the Portuguese Association for CDG. And recently, we launched a Skype service, which is focused for families that are newly diagnosed, and it aims to help families and to clarify the doubts that families have. And these are like meetings, 2 hours meetings that we perform with these families. Finally, we have a guide to understanding CDG. It is available in Spanish, English, and soon it will be available in Portuguese. And this guide, it was coordinated by our organization, and it was done with different CDG experts from worldwide. And it is an informative tool for families. We have as well, as a service to families, a web page in 3 languages. Hereby you can see the link. And we have actually a work in progress. We aim to expand the information. We would like to have a model of informative medical record, and we would like as well to do the webpage more interactive, and as well finally we would like to do fundraising through the webpage. In the right side of the slide you can observe the type of information that we aim to have available about other metabolic diseases, and it will be like a kind of summaries of different diseases, in which we will have the synonyms of the disease, classification, the code by the organization OMS, features of the disease, the number of population affected. We aim as well to have some bibliography for families, the laboratories of diagnosis, as well the name of the reference medical doctor, and finally we would like to have available the existing patient organizations. Another important service that we give to families are the family conferences. Last year we had the first Luso-Hispanic CDG meeting that counted with the presence of the Professor Yaken, the medical doctor that discovered the disease 30 years ago, and this is the best moment in order to interchange scientific and medical information with families. These conferences, they give visibility to the disease and as well to the work performed by the CDG experts. In this last conference that we organized last year in Barcelona, the first Luso-Hispanic CDG meeting, we were able to appear in several blogs related to health, and we were able as well to appear in some publications in the domain of neurology. For example, this publication, it is written by almost 4,000 readers, and we were able as well to appear in the most important medicine journal in Spain, which is the Diario Médico, which is written by 60,000 readers. concerning the activities that we undertake in the domain of networking. We are patient representatives at the international level. We attend different conferences that are focused on inborn errors of metabolism, rare diseases, or CDG. And we are as well patient representatives at the national level. For example, last year we participated in the Inborn Errors of Metabolism and Neurodegeneration conference that was organized by Sociedade Portuguesa de Doenças Metabólicas, and it was done in Porto, Portugal. And we participated as well in the 7 Social Responsibility Week, and in these conferences we had the opportunity to expose some of the material that we have done in our organization. We participate as well in conferences by presenting oral and poster presentations, and in the last 2 years we participated in many talks in different conferences, as you can observe in this slide. Concerning awareness amongst public and healthcare professionals, we have done and coordinated a fairy tale that explains in a non-specialized language what are CDG, congenital disorders of glycosylation. This fairy tale it was dedicated to Professor Iacan last year in the first Hispanic CDG meeting, and it was done in collaboration with Hospital São João de Déu in Barcelona and Hospital Clinic, and we had the precious contribution of 2 neuropediatricians, Dr. Belém Pérez Dueñas and Dr. Mercedes Serrano, and 2 biochemists, Dr. Paz Briones and Maria Antónia Vilaseca. They did the text and as well the cartoons for this fairy tale. We did as well different conferences targeted to the general public and healthcare professionals, and in these conferences that we organize, we are not focused on only one disease. We present different topics that are of general interest in rare diseases, like for example orphan drugs, different support therapies like speech therapy, etc. We support the projects that other organizations or parents do. For example, this project, the CDG Community Store, it is a project for to do awareness and dissemination related to CDG, and in this case, families and the people in general, they can buy products with the international logo for CDG. Another activity in the domain of awareness amongst public and healthcare professionals, as I mentioned previously, are the conferences. And this year we were selected to participate in the International Carbohydrate Symposium. And it was a very interesting activity because the medical doctor that discovered the CDG was as well invited, and we gave our talk just after his presentation. And this was a unique opportunity to do awareness amongst glycobiologists. Finally, in this conference, there was as well the official presentation of one book of the Royal Society of Chemistry, and we were as well invited to write a chapter for this book, which is named as Congenital Disorders of Glycosylation from Glycoproteins to Patient Care. And this was as well done in partnership with 2 different CDG experts, Dr. Paz Briones and Dr. Maria Antónia Vilaseca. Another important project that we have right now in the domain of awareness for different rare metabolic diseases, it is the translation of Guia Metabólica in Portuguese. we coordinated a team of more than 30 experts in order to translate almost 60 leaflets, all related to different rare metabolic diseases. And we did as well the translation from Spanish to Portuguese of different fairy tales. They are in total 5 fairy tales that are related to different rare metabolic diseases. And importantly, recently, some fairy tales, they were represented in different libraries in Catalonia, and it was a huge success in terms of awareness and dissemination of this group of diseases that are largely unknown in the society. Concerning awareness amongst public and healthcare professionals, we do as well different press releases and different articles about different subjects, like for example the activities of different associations for CDG. We participated in an interview performed by Rordis, in which 2 mothers from different generations, they gave their testimony, and the title of this important article is Living with CDG, 2 Stories, 1 Shared Hope. Finally, we have a CDG kit for awareness and dissemination that it can be used as a template for families to go to schools or to healthcare centers in order to introduce what is a rare disease and as well what is living with CDG. And this project, it was a project done in collaboration with Andrea Berarducci from USA and Bas Holten. And we have as well a Skype service that can help families in order to perform their own PowerPoint in order to perform this kind of activities. Concerning education, we did different projects in collaboration with different students from high schools. For example, a project that consisted in performing a newsletter about different neurological activities. And this project was done with a group of students from the school, from the high school of Caldas das Taipas in Guimarães, Portugal. We participated as well in the project Patient First project. We participated as well in one project from one university that aimed to characterize the non-profit organizations in Portugal. And finally, we participated by performing different play-decide game sessions. This game contributes to the improvement and enhancement of understanding of different issues related to rare diseases. And you can see the link in this slide, and you can access to this game through through this webpage. As well, in terms of educational campaign, we give different talks in, for example, in faculties such as in the Universidade Nova de Lisboa in Portugal, and as well, for example, in the diagnostic center in Porto, Portugal, the Instituto de Genética Médica, Dr. Jacinto Magalhães, and in other many places. As a short-term plan in terms of education, we would like to boost projects amongst universities, and we would like to potentiate meta-analysis projects and summaries in different languages related to CDG and other rare metabolic diseases. There are different faculties in which we aim to potentiate this kind of projects, like for example medicine, biology, biochemistry, psychology, etc. We would like as well to potentiate some work in the area of support therapies, because it is a huge concern for our families, and we would like as well to boost projects in the graphic design area. For example, we would like to have the fairy tale as a video in order then to go to schools or to libraries and to show this video as an awareness and dissemination tool. In terms of social care, for our association it is very important to analyze the economic burden of these diseases in our affected families. And finally, we would like to potentiate projects in the media. For example, we would like to have more articles in the area of journalism in order to potentiate the interest of society for rare diseases. And another example of awareness and education activity, it is the learning course of glycoscience. Finally, in order to potentiate and incentivize scientific and medical research, we organize different events that link researchers, clinicians, and patients. And one example, it was done last year in the first Luso Hispanic CDG meeting, in which we had the participation of different researchers that aimed to implement projects in the area of CDG, and one of them it was Professor Javier Corral from Universidad de Murcia in Spain that proposed a project, and one of his students, PhD students, went to Leuven in Belgium and established a collaboration with one of the most important laboratories in the CDG area. Finally, we as well participated in writing different research projects, one of them with Professor Paula Videira from the Faculty of Medical Science in the new University of Lisbon. And we as well can potentiate basic and clinical research by giving visibility to the work performed by our CDG experts. In one hand, when we participate in different scientific and medical conferences, we can be very helpful by transmitting information about the reference laboratories that are involved in the diagnosis for CDG, or for example, we can give visibility to the work performed in the labs in the CDG International newsletter. Finally, we establish partnership with researchers and medical doctors, and we did already different projects. In one hand, we participated in the CDG online community, and on the other hand, we participated in the APCDG, the European Platform for Rare Diseases Registry. Hereby you can see the CDG online community, which is a platform coordinated by Eurordis and NORD. NORD, it is the National Organization for Rare Diseases in the United States of America. And as you can see, this platform, it is equal for all diseases that are in this website, the Rare Connect website. And in one hand, we have the part of understanding, which is the part in which families, they contribute with videos, text, etc. In the other hand, we have a part dedicated to Meet, in which families can use a service of translation, and they can interchange and share their experiences with parents from different countries. And finally, we have a third part, which is the Learn part, in which many CDG experts, they contributed with different documents, articles, in order to show the work that they are performing in this area. For our organization, this project improved the visibility of our non-profit associations. CDG patient group's role, it is involved in communicating to the remaining members of the community. We have as well very useful information, research news, policy developments, as well events, etc. And very important, in this website, we have a family referral directory, which aims to connect families that are living in the same region. For example, recently we included a patient representative from Greece, which is the first family diagnosed in Greece, and we think that there are many other families that will be diagnosed in the near future, and this will be very helpful for the future families to have already a contact in order to share experiences. Finally, concerning the APRARE, the European Platform for Rare Disease Registries, we participate as a Euroglycanet representative, Euroglycan and Euroglycanet. They were two important European networking that boosted research, diagnosis and treatment in CDG. And this project, it is very important because the patient registries, they can boost the formation or the elaboration of natural histories of the disease. It is very important as well from an epidemiological point of view, and as well for clinical research, because it allows, patient registry allows the disease follow-up, the disease surveillance, as well the treatment evaluation. We can as well, thanks to a patient registry, we can have access to treatment monitoring. We can have access as well to a mutation database, to a possible genotype-phenotype correlation, and it can be a benchmarking for improvement of quality of care and development of clinical care. Finally, our presence in this European project can lead to the development of different guidelines and as well to a proper social care planning. I would like to finish my presentation by pointing out the importance of partnership amongst families, researchers and medical doctors, because it gives the best results for all these stakeholders. And finally, we are all in the same boat and we are lifelong partners. Our hope is we hope that in the near future we will be able to support research by promoting calls, fellowships, by having patients as advisors in different research projects, and we aim definitely to have a research driven by patient needs. For that we are as well getting some training, we are as well learning on how to write projects and how to get funds to support different research projects. Finally, I would like to finish my presentation with this sentence from the position paper of Eurordis that is focused on patient priorities and needs for rare disease research, in which this paper mentions that empowering patients in research means recognizing that patients are full and equal partners, developers, funders of research in rare diseases. And our aim as an organization, it is to be an equal partner to fund research and to promote research at the international level. I would like to thanks to the CDG Patients Voice. As you can see here, it is present at the international level, and we have CDG patient organizations or foundations present, for example, in the United States of America, in Canada, Portugal, Spain, France, Germany, etc. And then we have what we nominated as CDG active patient representatives, nucleos, that are present in Netherlands, UK, Ecuador, Brazil, Finland and Australia. Hereby you can find the different things from different CDG associations, and as well our email. And we would like to thank to all families and our members, and we would like to express that we are grateful to all medical doctors and researchers that are currently changing the CDG and other rare metabolic landscape. And their efforts, they are contributing to improve scientific and medical diagnosis, clinical manifestations, and they are doing many efforts in order to find treatments for the different CDG. We are particularly grateful to Professor Yaken and as well to all our collaborators